Hi, everyone. It's Dr. Paul here from the East Ontario Health Unit with another weekly update. Today is July 13th, and I'm going to give you an update as usual. First, starting to share my screen with you. I'm going to start with our local statistics, which, like the rest of Ontario, seem to have increased over the last week or so. We are definitely in wave 7. At this point, if we're looking at our hospitalizations, we're up to 14 hospitalizations right now, 2 in the ICU. What's really went up is 16.7%. Our positivity has really shot up, and as I'll show you in another slide, it's among the highest in the province right now. We've had 11 outbreaks for more than last week. If we're looking at sort of the positivity trends here, you can see here that we have gone up drastically here in this graph here. If we're looking at our wastewater, it looks like a stable, a bit of an increase in Cornwall. If we look at Hawkesbury, there is definite increase over there. If we're looking at Castleman, again, down and up again with a bit of a stabilization. And now for the first time, we've got Morrisburg. So Morrisburg, and this is a different scale, but still trending sort of down and then up again. So again, this is information that is not surprising to us. We are in a 7th wave at this point in time. We do believe that we'll have another week or two of sort of this and then starting to go down. We believe that the original wave started around this wave, the first day of the wave, so to speak, was around 19th of June, something like that. And other countries have had, 4 weeks up, 4 weeks down. So we're headed towards the peak and sort of going downwards. And our main concern really is decreasing amount of infection. The consequences are, yes, the hospitals are increasing, but they're not overwhelmed by COVID cases. They're overwhelmed by the fact that some of their staff are off because of COVID, and they're having difficulty staffing that, and that's what we're seeing within that service. All the service industries has been affected that way, predominantly and importantly for the health, as you know. I'm going to now share with you my another graph that is the usual scorecard that I review with you on a weekly basis, and this one is going to talk about our numbers. It's really going to show basically where we are with those indicators. And as I can see right here, basically we're sort of seeing increases across everything: cases, deaths, positivity, outbreaks, hospitalizations in ICU across the province. And so again, that coincides with that wave. And if you want to look at and compare other countries, we're seeing here, again, most of the countries increasing. You can see sort of steep increases, a bit less in Denmark and those other countries, Netherlands, and you can see where Ontario is. We're kind of increasing, but slower, not to the pace what we're seeing up here, not to the extent that these countries are going. And you can see Portugal that entered the 7th wave earlier than us is now in a downturn, and some of the other areas as well. So again, this is something that we're going to be keeping an eye on, but it's not only us. If we look at the rates across our provinces, again, you could see sort of an increased rate across Ontario. Predominant Hamilton increased, Northwestern is now going down. If we look at health units, again, most of the health units have had an increase, including our health unit, the Ontario Health Unit, which is now here. You could see there's a bit of a more sharp increase as compared to previous weeks. And again, this is not surprising given our high positivity that we have right now. So again, we're witnessing this. I think that we're about to peak and go down, but that's something we're going to keep a close eye on. This just gives you an idea of where we are with the numbers across the province. At one point we were below 30, and now you see it's going up again, but it's going up provincially. And again, that's part of the wave. One of the things that I wanted to talk about here, this is Eastern Champlain. This is hospitalization volume over the last 2 weeks. And you could see that, we were quite high, 70 here, July 7th, and that kind of is that was something like a week, 2 weeks after Father's Day. We had a Father's Day surge, and usually with cases, you get about a 2 to 3 week delay of hospitalizations. So we're seeing that it's going down right now. So we're having less of a hospitalization rate across our health unit. But again, it's not that's overwhelming our hospitals. It's more the fact that a lot of staff have to be off for a couple of for isolation, and that really is impinging on their ability to provide services. If we look at the provincial data in terms of wastewater, you could see we're on an uptick here in the province. You could see east as well, and you can see most of the province is on an uptick, Toronto and so on. Northwest is kind of stabilizing, as is Central West. But again, not surprising, we are in this, and we should be seeing a flattening and then a down curve, hopefully over the next, I would say week or two. If we look at the positivities, again, provincially, it was down and then up again, and ours is among the highest. And you'll see here in the next slide that we're actually among the second highest in the province in terms of positivity. We're almost 20% right now, and you could see a very sharp increase from what we had 2 weeks ago over the 2 week trend. And you can see all health units are increasing, over the 14-day period, and only a few are decreasing. So again, we are about to turn the corner, but we still have relatively high levels of activity in the East Ontario Health Unit, manifested by hospitalizations, by outbreaks, and by our wastewater in certain areas. I just wanted now to shift to vaccinations and spend the rest of the time talking about vaccinations and the new announcement that was made today about fourth dose eligibility. So first of all, again, I just want to show you this slide again that really shows us that the most vulnerable going into hospital, going to the ICU and dying are really people over 60, predominantly 70s and 80s, as we can see here. We can also see that the rate of hospitalization, ICU admissions, and death, unfortunately, is much higher among the non-vaccinated versus the vaccinated. So again, this just shows us that even if we can't prevent cases 100%, we are preventing hospitalizations and severe disease. So today, as you know, there was an announcement that talked about, first of all, currently, if you look at our vaccination rates right now, you could see that we're probably 56% overall third dose. We're about 38% fourth dose, and that's really among the 60 plus. We're close to about 60% in the 80 plus, but we still have got a ways to go for the 60 and 70-year-olds to get up to high levels of fourth dose. And as you know, that was a recommendation that was made several months ago in order for the individuals who are at higher risk, as I showed you before on the graph, that those are the individuals that we need to protect more. So that's why the fourth dose was offered to them initially, so they could be protected over the summer during surges and so on. Now, given the fact that we're now in a pandemic, wave 7. We're seeing, increased hospitalizations and wearing off of vaccines, third dose and, second and third doses. The government has made a decision to make people 18 plus eligible now. So as of tomorrow, you can book your appointment 5 months after your third dose. You can do it as short as 3 months to get your fourth dose. And so we strongly, although people are eligible, we have a strong recommendation still for individuals over 60, First Nations, residents of long-term care, people working in long-term care, people working in healthcare settings, and individuals who are themselves moderately or severely immunocompromised. They should get their fourth dose if they're eligible, and you should consider a fourth dose even if you're healthy, but if you and are eligible in terms of time, that if you're living with individuals that have that are vulnerable and so on, so you want to protect them as well. But one of the things that I just wanted to ensure that people get the message is that fourth dose, yes, but like I said, 57% of our total population has had their third dose. And if we look at age groups, I can show you here that, as you know, it's 12 plus that are eligible for third dose. And if we look at the 12 to 29-year-olds, 78% have not received the third dose. 12 to 39-year-olds, 71% have not received the third dose. 12 to 49. So basically, everybody who's eligible now, like less than 60, has not. The majority have not received the third dose. So we can't talk the fourth dose to these individuals before we address the third dose. And so I think that I'm just going to repeat, and I showed you this a couple of weeks ago. We do know, and the majority of the individuals got their second dose really over 6 months ago, and they're due for the third dose. And there's a couple of good reasons for getting your third dose. In that, you need to be up to date. So before you can get your fourth dose, you need to get your third dose. And a lot of people are walking around, like I said, look at the numbers that I showed you, who are not third dosed at this point. And so what we're trying to show you now is that you could see with the first 2 doses against Omicron, against hospitalization, you get excellent protection initially, and then that wears down by about 6 months. And so that a lot of people are in this area here right now. And you could see the third dose, what happens is you get a higher protection, particularly among the third, the dose, and that 3 months after the dose. And that protection remains high even 4 to 6 months. And so even people probably who are 7, 8 months at third dose here probably do have some form of protection. And this is really mostly in healthy individuals. Obviously, the vaccines don't work as well in sick individuals or individuals who have underlying medical conditions. The other important thing that I want to point out is the amount of virus that you shed. So yes, we do know that people who are vaccinated can still get it. Obviously, but most of them are protected from being hospitalized. One of the things that we're also looking at the vaccine is that, are you less prone for spreading the virus? So you compare second and third dose. So this is a graph here that shows 2 doses, people who have an infection, despite having 2 doses, how much virus they're shedding or transmitting, and versus third dose, 3 doses. You could see it's much, much higher. So basically, in simple language, individuals who are third dose vaccinated who do get the infection are much less contagious to others around them than if they had less doses on board. And that's very important. So when we go back now to sort of the bottom line here, the bottom line is that we want to be able to bring everybody to a high community level of protection, particularly now that we're seeing wave 7 and into the fall to protect us. We're not getting high enough uptake of the third dose among the population that is now getting infected. Most of the people that are being infected are less than 50 years old, 45, 50 years old. And so, and as you go down the age spectrum, that number increases in terms of percentage of not being third dose vaccinated. And so we need to get this population here vaccinated. So bottom line is, you need to be up to date. A lot of people in our area are not, and this applies to Ontario as well, have not had their third dose. So if we increase those people walking around to the third dose protection, and then people who are eligible for the fourth dose can get the fourth dose, particularly those individuals that I've talked about, that will increase the protection in the community and then protect the community from severe disease collectively. Okay, so that's very important. So I'm urging everybody not to lose the message. Okay, today there was a media release by the government. Yeah, fourth dose available for 18 plus. But let's not lose track of the fact that there are up to 78% of certain age groups in our area are not eligible for fourth dose because they haven't got the third dose yet. So we need to get that third dose on board. So be up to date, whether it's second to third, fine. If you're eligible for your fourth dose, excellent, no problem. You can go and get it, particularly if you're in the categories that I talked to you about before. So bottom line is that we're now at an important juncture now of trying to seeing sort of a decreasing of the vaccine effectiveness, particularly among a lot of people walking around who've only had 2 doses. We're seeing the virus, being much more easily spread. This B5, which now is predominantly BA5, one individual can infect 10, 15 people. And so we need to be cognizant of that. And of course, be up to date with your vaccinations, whether it's third or fourth dose, depending on your circumstances. And very importantly, don't forget, obviously, masking is very important now. Indoor masking should be done if you're in a public place crowded place. And even if you're outdoor going to concerts or there's a lot of people crowded, you should be considering wearing a mask as well, particularly if you're vulnerable or around vulnerable individuals. So collectively, if we do that, we'll be able to, turn the corner on this wave 7 and be better prepared in the fall. And of course, we have other things that are coming in the pipeline. We're looking at, the Omicron vaccine would have Omicron in it, but we don't know when that's going to be available. It's probably going to be available in the fall at some point. We're also looking at any day now an announcement by the government by Health Canada regarding vaccinations for 6-month-olds to 5 years of age. That too we're preparing for. So there's a lot of things that we have. We have antiviral medications. So we're in a much better position. We're keeping an eye on new variants and so on. But again, moving forward, we're going to really have to, as a community, continue to do what you've been doing, stay home when you're sick, wear your mask and so on. And importantly, for that majority of individuals who are less than 60 years of age, who are the ones that are getting infected right now, please go and be up to date with your vaccines. And for many of you, that means getting your 3rd dose. And for those who are eligible for 4th, of course, go ahead and get it. It's available through our health unit, through multiple pharmacies around our area. So once again, thank you. See you next time.